perimenopause basically is when your hormones start to fluctuate more than the average cycle expectation, because all of us women are cyclical beings, so our hormones go up and down in the cycle on a good day, but in perimenopause they start to fluctuate and become even more erratic. So in some women, the first sign is actually just a change in their periods. And I often tell women, those women are quite lucky because that's a quantifiable thing. It's something that you can notice and not think you're going crazy or it's in your mind. But for other women, it's a lot more insidious, and that's the cohort of women that I'm really passionate about helping, because it can be forgetful. Exactly. They're like, oh, I'm just stressed, I'm tired. But yeah, the forgetfulness, the brain fog, where you feel like you're pulling memories through treacle. And poor sleep, because progesterone is actually one of the hormones that starts falling first in perimenopause, and it has a calming effect on the brain. So poor sleep is often one of the first ones. Waking up in the middle of the night, not being able to go back to sleep. But then it's also other things, like first time ever in your life you're diagnosed with depression, or you've had panic attacks, palpitations in the middle of the night. You're unable to cope with things you used to be able to cope with. So a lot of my patients are business owners, and they say, like, I promise, I know you don't know me, but I promise I used to be able to do this.
I used to be nicer.
Yeah. Oh, the rage. Rage too is a big one.
I used to be much nicer.
Yeah, so it's really because of the way that estrogen acts on our brain and our body, it is really a whole body change. And the thing I'm most passionate about explaining is it's not a disease, it's not an illness per se, it's a natural process. However, just because things are natural doesn't mean that we have to
ignore them or suffer.
Yeah, exactly. Periods are natural, but they suck.
Yeah.
For you women.
Yeah.
It's
part of being a woman.
Yeah, basically.
And I love how we are. And sometimes, you know, when it's painful or when we're going through some sort of phase, we think, men get it easier. Well, I mean, first of all, they don't. Right?
Yeah, I mean, it's a different challenge.
But I love being a woman.
I do too.
I was like, and I used to be in corporate, and it was always about like women rights, you know, like in equality and all of that.
Yeah.
And now I always say, by default, we're better.
Yeah.
You know?
Yeah.
It's just when we embrace the phases in life.
Yeah.
And we prepare for them.
Yeah.
And we know where we are.
Yeah.
And we get help.
Yes.
Because we obviously need help. And I think we fall into the mistake that we want to do everything.
Yes.
And we're so strong and suck it up.
Yeah.
You know?
Yeah.
And no. I mean, there's so many resources out there for us to help us in every single domain. And there's the doctors, and there's the physios, and there's the, I don't know, mental health.
Yeah.
There's the fitness portion that we cannot ignore. So there's all these people out there that are specializing in your health, but then you're not going out there and seeking that help.
Yeah.
And that's what I always say to women, like, what are you waiting for?
Yeah.
All of this is going on. What are you waiting for?
I think women are overwhelmed with misinformation.
Yes.
And a lot of it is, you know, you ask your friends and family, and maybe you go to your gynecologist for advice. And the problem is that women's health is so poorly understood.
Yeah.
And
there's always a lot of rubbish as well.
Yeah.
And
you got people telling you to cycle seed on this day and whatever, like loads of weird advice. But going back to what you were saying about the difference between men and women, I think when we're truly powerful is when we realize the difference between equality and equity. So equality is, you know, we're equal and I need to be on a level playing field to men. Equity is when we realize that the beauty in our differences as men and women, and we support women through that to allow them to be their best version of themselves.
Exactly.
And that's exactly, I'm a small player in that big tapestry of a woman's life, but yeah, it's important to realize that.
But every small piece helps the bigger picture.
Yeah.
And I think when you and I get together and amplify these things, and then the third person comes in from another discipline, and there's the fourth person that comes in, then the whole picture gets drawn beautifully.
Exactly.
Right?
Yeah.
Where we have a support system.
Yeah.
that is looking after us.
Yeah.
Right?
Yeah.
Back to misinformation.
Yes.
Every time I do a podcast with, I've done with a pelvic floor specialists, women health, like I've done several women specific podcasts. And every time I put it out there, the amount of questions that I get, and let me tell you, I don't usually have the answer to all of those. There is the ChatGPT and we can research stuff, but there's like, okay, so how do I book with this doctor? Or are there any other doctors that are doing this? Or like, oh, I've never thought about fascia release. So how does that work how did you use it? So people, yes, information is at your fingertips. Yeah. But then there's the personal, because information is so abundant, sometimes we want to hear the personal story. Yes. Right? Yeah. And we want to see how it worked for her. Yes. So that, I don't waste time going around all the time, because I don't have time. I don't have resources. Yeah. And I want to see something that's proven really by somebody else. So people are always looking for those personal experiences. And that's why I'm like, let's talk about it. Yeah. Let's talk about it, Yeah. Let's walk away from, oh, I'm aging, it's so shameful, I don't want to. Sorry, excuse me.
No, don't worry.
I was having a conversation with this girl once, a friend, and she was saying, and she's around, I think, 42. I can't sleep anymore. Last year has been really tough for me. And she was going through some health condition as well, so that's part of it. And she's, I'm having these panic attacks. And obviously, I've talked to menopause doctors before, so I said, did you check your hormones? Yeah. Are you going? She's like, her words, I'd rather live in denial.
It's fear-based.
I don't want to, and I don't want to feel like I'm aging. I can't handle this right now. But I'm like, and there's a very thin line how much we can go and say, no, but you need to seek help, right? Like it's, and I'm like, but you're going through so much, and maybe that would help. Yeah. It's like, I'll delay it as much as I can. Exact words.
The thing is, I feel like the problem is that you have two camps. There's one camp that are like, perimenopause is a sickness, and
overdoing it.
Yeah, exactly. And saying like, if you take medication, then you're going to get breast cancer. And then there's the other camp, which is like, oh, my generation never spoke about this. We all passed through it completely fine, and we had zero symptoms, which we know is factually incorrect. 90% of women will have symptoms
at least.
But there's no representation of the middle ground, which is like, okay, maybe I'm not struggling, but there are a couple of symptoms that I would like more understanding about why they're occurring. Yeah. Less fear-based, basically. Like, if you did not know that you were going to ever get a period, and then one day you start bleeding, you're going to think that you're dying.
Exactly.
Freak out. But the girls that are educated that, when you turn 12 or 11, you'll stop bleeding, you're safe, everything's fine. They cope a lot better with their first period. So fear-based information giving is also an issue. And in the Middle East, we have a lot of that.
No.
I think the good thing is, like you said, personal stories, I think, have more of an impact on getting someone to change their
action.
Yeah, exactly. Empower themselves, because it's not our ability to have periods it shouldn't attach itself to our identity as a woman. Like at the end of the day, whether you have kids or you don't, whether you have periods till 50 or they end at 23, you're still a woman, you still have all the power. And I think that's where we need to focus on a bit better as women. Yeah, like,
so I'm 41. I have, you've told me the symptoms, so sleep, panic attacks, change in cycle, and we'll go back to what change in cycle means, because sometimes it means several things.
Yes.
So I have one or two, maybe three of the symptoms, whatever, brain fog. What do I do?
So I think the first thing is just understanding that this is a normal, expected change. So, for most women, maybe 7 years before their periods end, they're going to get some symptoms. To if you understand better that this is normal and it's due to the hormonal fluctuations, for some women that's enough. They just want to know that they're perimenopausal, which is the years before their periods end. Okay. For some women, it's impacting them so much to the point where it's, there was a study in the UK, 50% of women said it affected their home life, for example.
Or relationships.
If it's getting to the point where it's encroaching on your identity and you feel like you're not yourself anymore because of those symptoms, that's when it's important to see a menopause specialist. And why I caveat about someone with a special interest in menopause is oftentimes the reason why women are delayed in being given help or appropriate help is because of the fact that they just think that all doctors have awareness about perimenopause and menopause.
Don't assume that, please.
Yeah, I always tell my patients, look at the qualifications of the doctor, or not even doctor, physio, whoever that you're seeing about whatever
is going on.
Look at the qualifications, look at what the special interest of that person is to know that you're getting the appropriate support. I've had patients come in. I had one lady who had premature ovarian failure, or ovarian insufficiency is what we also call it. So she became menopausal before 40 and she'd been seeing a specialist for years and been given the wrong information, and she just assumed, I've gone to the right place.
This person is
exactly. So even from my family, I always say, if you've got asthma, go to the best asthma specialist.
Yeah.
Not every respiratory doctor has a special interest in asthma, for example.
Exactly.
So yeah, that would be my biggest advice: is empower yourself with the information that you're probably going to perimenopause, and then you decide how much it's impacting you. My thing that I always tell whenever I do talks, or even when I meet patients, I say, when you come to me, you're basically coming to a restaurant. I have a menu, and it's the only part of my medicine where my job isn't to force you to take a medication or to take any action, actually.
Okay.
It's just to show you, these are the options, and you pick.
Yeah.
You might not want to eat anything. You might just be coming to have a chat with your friend.
Yeah.
You might be coming to have a full 3-course and you want the HRT and you want the pelvic floor physio, which, by the way, is super important for all perimenopausal and menopausal women.
Mm-hmm.
So my job is basically just to open the menu and tell you, these are the options in this decade of your life. What would you like? That's it. When people get a chest infection, it's not your decision to take whether you want treatment or not. You come to me and I say you need antibiotics.
It's the same way.
But yeah, so basically
that's how it works.
Yeah.
Because I think there's an assumption nowadays that if I'm having one or two of the signs, that I have to get a hormone check, a blood count or whatever.
Yeah.
And then if that doctor doesn't ask me or make me do that blood test, then that doctor is bad.
Yeah.
I've heard it.
Yeah.
I've heard it, right? So I think what I'm trying to say, exactly to your point, there's a menu of things that you can do depending on the symptoms, depending on your lifestyle, depending on so many things that you would advise. And then, no, it's not necessarily, it doesn't have to always end in let's get a hormone test, right?
And about the hormone test, so this is so important, and I tell all women this. If you are over the age of 45, you do not need a hormone test. There is no hormone to check for perimenopause. Because by definition, your hormones are going up and down, so we don't have any reliable measure. There's no test for perimenopause. So I get a lot of patients who say, I'm starting to get symptoms, I'm in my 40s, I went to my gynecologist, she did hormone check, and it was all normal. And it doesn't make sense to me because I don't feel normal. It's so important to understand that hormone checks are inaccurate and don't give you any information in the perimenopause period. The only time it's useful is if you have, for example, a Mirena coil and you don't know whether you're having periods or not. Then it's useful because we can tell you that potentially you've gone through the change, you're menopausal without realizing. But in your case, at 41 with a couple of symptoms, a hormonal check tells me nothing. Yeah. You're still having periods, so by definition, a blood check is not going to give me any information. There's no internationally recommended level of estrogen or progesterone in the perimenopausal phase. It's like this.
Yeah.
So, yeah, blood checks are not something I routinely do for everyone.
Perfect. And I really wanted to clarify, because that's the assumption now.
Yes.
That as soon as you see a menopause specialist, then the first thing that we'll do is a blood test. No.
Yeah.
It's not necessary, nor they'll tell you everything at certain points. Full stop.
Exactly.
You know? And it depends on where you are, what's going on, but it's not a must. Is
just like puberty for children. If you went to a doctor and you asked them, is my 12-year-old girl pubertal, and that doctor said, I'm not sure, I'll do a blood check, you'd walk away like, what? No. Of course she's pubertal, she's 12, she's getting breast development, she's having periods, I don't need a blood test. So it's the same thing that in perimenopause we do not need blood tests. The diagnosis is made on symptoms and symptoms alone.
Yeah.
And if you do need HRT, the HRT we're prescribing it's not going to shut down the process.
Yeah.
It's just to top up so that you're not struggling with symptoms, but you are going to become menopausal. Your periods are going to end whether you take HRT or not. We're not prolonging anything.
No. And there's a confusion about, let's delay as much as possible, which is not the case.
No.
It's not.
You can start whenever
you...
Yeah, it's case by case.
Yeah.